Hello everyone, welcome to KNO Academy YouTube channel. So in this video, I'm going to explain okay NORCET-8 question paper. Okay, so NORCET-8 question paper as we expected. So paper was very good. Okay, and after completion of CRE exam, many people having doubt that how the NORCET-8 question paper will be. But the question paper is very good, and many people called me and told that paper was very easy. And what are the things we have explained in our groups and test series? So same question, maximum questions we have covered. Okay, so we'll see. So in this question I have done collected 50 MCQs. Okay, that is memory based questions we have collected. So it will be like a part 1 and part 2. So part 1 I am releasing now, and part 2 we'll do after some time. Okay, so the first question. Okay, the first question, meaning of jamaisu. Meaning of jamaisu is, it's very easy. So this is all expected questions only from psychiatry. Okay, so I will tell you, I will explain very nicely. Okay, jamaisu means unfamiliar to familiar. Unfamiliar to familiar. I will tell you how. Okay, suppose I have born in Bangalore. I have born in Bangalore, but some people brought me to Mumbai. Okay, then I'll tell that Mumbai is very known place to me. This area I know, that area I know. Okay, I have stayed here, like that I can tell. So that is called Jamaisu. Okay, but opposite to that, deja vu. Okay, deja vu means familiar to unfamiliar. Familiar to unfamiliar. The same situation. Okay, suppose again if they brought me to Bangalore, though I born in Bangalore, okay, they brought me to Bangalore, then I say that no, this area I don't know, this is not my house, like that I'll tell. So that is called deja vu. Okay, so hope you understood. Then they asked Ambu bag parts. Okay, parts of Ambu bag. So I'll explain here. So this is the face mask. Okay, now this is the mask cushion. So pressure gauge, this is the pressure gauge. Then outlet port. Then this is the self-inflating bag, then reservoir. This is the reservoir, then this is the oxygen connector, then yeah, this is only reservoir. Okay, then one more port will come, that is a pop off value. It will be here. Okay, so very important point here is the oxygen reservoir. Oxygen reservoir we should not connect without oxygen. Okay, without reservoir we can give Rambo, but whenever we are connecting the Ambu bag with reservoir, we have to connect the oxygen. Without oxygen we should not connect the reservoir. That is the very important point. Why? Suppose if you are connecting the, see, this is the reservoir, this is the Ambu bag. If you are connecting the reservoir to the Ambu bag, okay, so we should give the oxygen. Otherwise, this is the only Ambu bag, so we can give the room air oxygen at 21% room air oxygen will be there, na? That will deliver to the patient if you are not connecting to the reservoir. If you are connecting the reservoir, so it will deliver 100% of oxygen. Whatever we are connecting oxygen, that will deliver the 100% of oxygen will deliver. So that's why reservoir is always connect to the oxygen. It will give the 100% of O2. Okay, without reservoir it will give 21% of room air oxygen. Okay, hope you understood. Then hook technique in Ambu. So this is called the hook technique. Okay, this was the image based question. So I have inserted here. Then missile man of India. Missile man of India, even first standard students will tell that who is the missile man of India is the Dr. APJ Abdul Kalam. Okay, so I have collected even nursing and non-nursing question. Okay, so later will complete all the questions. Okay, don't worry. So APJ Abdul Kalam, who are all given this answer is the right answer. Okay, then which drug, okay, is not a part of first line of treatment in tuberculosis? So we all know HRJD. Okay, except that option was there, that is the amikacin. Okay, so amikacin was not the first line of drug in tuberculosis, though this is the overall put amikacin, that is the right answer. So in this question, actually in this session, I am not going to explain completely. Okay, so only question and answer oriented class. That's why I am explaining only the question. Okay, and some important things only I'll explain. Okay, later on we'll take more discussion about these topics. Okay, excessive menstrual bleeding. So the right answer is menorrhagia. Okay, menorrhagia is the right answer. Then gout. Gout definition they ask. So this is the accumulation of uric acid crystals, uric acid crystals in joints. So gout is a very big chapter. Okay, we will explain in detail. Okay, don't worry. For this NORCET mains, we will also release. Okay, so rapid revision classes, very important class in our YouTube. Okay, we have our team has already discussed. Okay, so this is the accumulation of uric acid crystals in joint. This is called the gout. Drugs of gout. This one. So allopurinol, that and all, we will explain in another class. Okay, don't worry. Indian aquatic animal, which is the Indian aquatic animal. Next question. So answer is Ganga River dolphin. So Indian aquatic animal is a dolphin. Ganga River dolphin we call. Okay. Then abruptio placenta. Abruptio placenta is a premature separation of the placenta from the uterine cavity. Okay. And don't confuse between the placenta previa and abruptio placenta. I will show the image. Okay. So this is the placenta previa. See, that is placenta is situated just behind the cervical os. Okay. And here see, this is bleeding we can see here. Okay. So placenta is situated here, but this is separated from the uterine layer. So this is called abruptio placenta. Placenta abruption and placenta previa both are the abnormalities of placenta's condition. Okay. So we'll see. Okay. So hope you understood. Placental abruption means premature separation of the placenta. Okay. Then prag maneuver, we have already shared many images. Okay, in group. Okay, frag maneuver. Okay, Barnes Marshall maneuvers. Okay, so many maneuvers are there. We have already shared. But today's question came is frag maneuver. Okay, hope you answered right. Okay, then which drug causes the below anomaly? See, all four limbs are affected. Okay, four limbs are okay, not ground. This is thalidomide. Thalidomide is the right answer for this question. Okay. Then first Indian in space who traveled to the space from Indian is Rakesh Sharma. I think everyone put right answer. Rakesh Sharma went in 1984. Okay. So this is the right answer. Okay. Then identify the abnormality of placenta. This was the image based question. So this is the filamentous placenta. Filamentous insertion of cord. Okay. Right answer. Filamentous insertion. See, normal placenta also will show. Okay. So this placenta is actually not connected to the this umbilical cord, no, not connected to the placenta directly. Okay. It is covered to the still whole placenta. Okay. But in normal placenta, see, it is covered completely here. Okay. So you can see the difference between filamentous placenta and normal placenta. Okay. Then next question. Identify the image. Today morning only we have discussed and I have shared some information regarding the CVP line. Okay. So this is the central line, CVC line. Okay. So distal, okay, no, white is the middle one. Blue is the this is the distal port. Okay, na. Brown color is the distal port which we are using for the CVP measurement. Okay. I think everyone put the right answer for this CVP. Okay. Then noun form of resist. Okay, resist they ask a word, so that is the right answer is resistance. It is the simple noun. Okay, resistance is the right answer. The next question, a person. This is very important question. We have asked and we have discussed it many times in our group. Okay, a person weighing 70 kg. So they have given 70 kg and 40% of burn. Calculate the fluid for first data. That is the we are using Parkland formula. So for your reference, just I am sharing the image here. That is the 4 ml into percentage of body surface area into body weight. Okay. So as per this data, 4 into 70 into 40. So this is equal to 11,200. Okay. So divided by 2 means 5,600. So 5,600 is the right answer for first 8 hours. Then another uh, this one balance this one fluid, no, we will give as another 16 hours. Okay, done. Then, before skin induction in surgical safety checklist, that is the timeout. Timeout. Okay, so I will tell you sign in, timeout, and so here see you can see. Okay, before induction of anesthesia, sign in. Okay, in sign in, so patient details will be confirmed. Okay, okay. Then before skin incision, timeout will be there. Okay, that team should confirm that surgery, right surgery. Then sign out, sign out. Okay, now here nurse confirm should the what whether how many instruments used, we can how many gauze pieces and proper documentation. Okay, for reference we can use this image. Okay, surgical safety checklist we have shared many times. Okay, we have shared many times, and also all NORCETs this question is included. Okay, surgical safety checklist. For this question, timeout is the right answer. Timeout is the right answer. Before skin incision. Okay, sorry, before skin incision. This is okay. Anesthesia induction is different. Okay, see before induction of anesthesia and before skin incision. Okay, next question. Sundarban mangrove. This is also we have covered in our non-nursing part, that is West Bengal. Okay, West Bengal. So who all put West Bengal is the right answer. Then patient position of craniotomy is the 30-degree position. Okay, this is the right answer. Just to prevent the uh, flow. Okay, flow and drainage. Okay, and to maintain the cerebral perfusion pressure. Okay, so we are giving 30-degree of position. Otherwise, ICP also will increase if you are giving wrong position. Okay, to prevent the uh, ICP increase and to maintain the CPP, we are giving the 30-degree position in after craniotomy. Okay, hope you understand. Overall, putting 30-degree, that is the right answer. Pre-filled syringes, one pre-filled syringes they have given. Okay, that is given for okay now pre-filled low molecular weight heparin, that is low molecular weight heparin. Okay, that is given subcutaneous. Okay, low molecular weight heparin, no, always we are giving subcutaneous only pre-filled syringes. Okay, so actually questions are not completed because we are collecting only memory based. Did questions we cannot include here. Okay, some questions we have collected like with all four MCQs, but here, okay, some questions incomplete, but I'll definite answer we are going to tell. Okay, then treatment of respiratory alkalosis. Okay, this is very easy question and very simple question. Okay, breathe with the paper bag. So it's just like a rebreathing. Okay, respiratory alkalosis is a type of hyperventilation. Okay, hyperventilation. Okay, so patient have already having hyperventilation, so much of oxygen is there but less amount of CO2 is there. Okay, less amount of CO2, that's why patient got respiratory alkalosis. That's why we have to give the paper bag like a, then we have to ask him to breathe inside, so that rebreathing will happen, no, then excessive carbon dioxide also will get inside and it will correct the this acid base balance. Okay, then excessive carbon the CO2 will accumulate, then it will maintain the acid base. Okay, hope you understood. This is very simple concept. And insulin site distance should be maintained, that is option was there 2.5 centimeter. Okay, from umbilicus. Okay, so this is umbilicus means always we have to use the around 2.5 to 3 centimeter common. Okay, normally. Okay, to prevent the lipohypertrophy. Okay, always to prevent the lipohypertrophy, we have to maintain the, and we have to change always sites also. Insulin giving sites also we have to change always. Same sites we should not give always. Okay, we have to rotation. That is also one plan is there image. So we will share you in the group. Okay, then ECG wave seen in the hypothermia. Okay, J point. Okay, J wave or Osborne wave. Okay, so here we can see that. difference. Osborne wave. Right answer is Osborne wave. Okay, J wave. So this is normal only. Okay, see here you can see J wave. Okay, or Osborne wave we call. So here I'll put Osborne wave, that is the right answer. Then identify the image. This is the uh, pap smear. Pap smear spatula. So this image we asked in our this one in our KNO Academy app. KNO Academy app. So in that you can see that question of the day. Question of the day. So in that all image based questions are included. So this question is also there. You can check it. Okay, pap smear spatula. Be first. This is very very important. Okay, many times this question asked. Okay, so explanation they asked. Okay, be first. That is the stroke protocol. Stroke protocol. So I'll tell you B. So this one abbreviation I'll tell you. B means balance issues. So suppose if I'm standing means I should maintain the 100% balance. Okay. Something missing in my balance. Okay. I should be alert. Okay. Then eyesight changes. Okay, eyelids drooping. If anything happen means I should be careful. And face drooping. One side face drooping. Okay. Then arm weakness. Any arm weakness. Okay. Then S means speech difficulty. If I am difficulty in speech means that is also a sign of stroke. Then T means if any of these signs, okay, I am facing means this is the time to call emergency. Time to call the emergency. Okay, hope you understood very well. Then identify the device used. Okay, this is my key. Okay, na low profile gastrostomy tube. So low profile gastrostomy tube. Okay, identify the device used for the feeding. Okay, for the feeding we are using this. Okay, so overall putting this answer is the right. Then tracheostomy site they have asked. Okay, in which area tracheostomy do. So this time we are very happy that overall done in clinical sites. Okay, overall done in clinical sites, they got excellent knowledge. Okay, and they have done very well. Okay, this is the second and third ring, tracheal ring. We are doing the most common site. Okay, na. So between the second and third ring, so we will do the tracheostomy. So here you can see. So image also you can see after in video also. Okay. Then complication of GBN, Guillain-Barré syndrome. That is the respiratory arrest. Respiratory arrest is the right answer. Okay, na? This is always come. Okay, na? Guillain-Barré syndrome complication is always respiratory because respiratory diaphragm will be okay, na? Weaken in this condition. Okay, so Guillain-Barré syndrome is also very very important. We will deeply explain in the next class. Okay, so right answer is respiratory arrest. And 4Ds will come in which program, national program they ask. Okay, so just I inserted image just to inform you very easily. Okay, you can take screenshots also after that. That is RBSK, Rashtriya Bal Swasthya Karyakram. Okay, what are the 4Ds? Okay, you can see defects at birth, diseases in children, deficiency conditions, and development delays, including the disabilities in children. Okay, to prevent this, okay, na, they have released the RBSK. So, overall put RBSK is the right answer. And complication of measles. Complication of measles is always otitis media. Overall put otitis media is the right answer. Complication measles we can explain very nicely. Okay, but the right answer is otitis media now. Okay, then morphine overdose. What is the next action? See, indirectly they are asking here. Okay, so instead of asking what is the antidote of morphine, they've asked morphine overdose happened. So what is the nursing next action? So they ask this is the naloxone. Administration of the naloxone is the right answer because naloxone is the antidote for morphine. Then Bandle's ring. This is very very important. Okay, we have shared many times this image also. Okay, so this is the dimple. Okay, na? Therefore, we can see na, this is the band listening. This is happening in obstructed labor. Obstructed labor, this will be happening. Okay, band listening. Then synonym of candid. This is the frank. Is the right answer. This is the truth. Okay, truth candid. Okay, na? Candid is the frank is the synonym of candid. Okay, overall put frank is the right answer. Then how many vaccines included in the national immunization schedule? Many people have doubted that 11 or 12, but as I studied, 12 is the right answer. Okay. Then triad of death. This also image which we have shared in our group. Okay. So triad of death is coagulopathy. One is coagulopathy. Second one is acidosis. The third one is hypothermia. Hypothermia, coagulopathy, acidosis is the triad of death. Okay. This is very important. Then this is also clinical based question. See, what is the difference? Sometimes I used to tell, okay, difference between clinical and theoretical knowledge. Okay, who are all, okay, na, working means in colleges, okay, na, they don't know this question. Okay, they only knows only theory part, but these questions are entirely different. Okay, all clinical based questions. Who are all working in clinical area or who are all preparing for competitive exams only knows the right answer for this. Okay, because see normal sodium value. Okay, right. Okay, that is 150. Okay, then 145 to 155 is the right answer. Then potassium is 3 milli equivalent. That is normal potassium is 3.5 to 5 or 5.5 sometimes. That is based on the reagent what we are used in our lab. Okay, so but here 3 is very less. That's why the right answer is okay, no, NS plus potassium supplement K plus. Okay, okay, means administer the K plus with NS is the right answer. Okay, overall put this is the right answer. Then odd ratio of depression. So this is the 0.75. So this is the OR decrease 25%. C is the right answer. Overall put this is the right answer. Okay. The next question, identify the image. So this we can see clearly that black area. Okay. Any X-ray if you see black area is always pneumothorax. Okay. Pneumothorax. Air in the lung. Okay. And difficulty in intubation. Difficulty in intubation. Difficulty in intubation and bleeding in mouth. So what is the next action? Next action they ask. So this is the cricothyroidotomy. Okay. So physician feeling a difficult intubation. Okay, na. But bleeding in mouth. So we cannot intubate. Okay, na. So what to do? This is the cricothyroid. It is a temporary method. Temporary method. So we can do it in ICU settings only. Okay. So I'll show where cricothyroid will be there. So this is the anatomy. Okay. This part is there na. A. This is the cricothyroidotomy. Then see B part is the tracheotomy. Here you can see tracheotomy. This is the cricothyroidotomy. So here we can make this one incision like this. Then we can insert the tracheostomy tube or ET tube. Okay, that is the trichoid ligament will be there. Then thyroid cartilage. Okay, now this is the thyroid cartilage. Okay, here we are doing the cricothyroidotomy is the right answer. Overall put cricothyroidotomy is the right answer. Then 39th question. Type of research study. Smoking for 10 years. If he having the history of smoking for 10 years, then it causes the lung cancer. What is the type of study? Is the cohort study. So I will tell you, this is the always prospective. Cohort is always prospective. Then case control is always retrospective. Okay. Case control is always retrospective. Antandre, this is we are going back. Then this is forward we are going. So I'll show here one image. Okay. Case control is always retrospective. Cohort is always prospective. And uh, from outcome to exposure. In case control we are doing from outcome to exposure. and in cohort from exposure to outcome. Okay, so hope you understood. Then next question. Schizophrenia patient, no compliance for risperidone oral therapy. Best management is means he is not adhering to the treatment. Oral therapy is not following. No compliance means he is not following our orders. Then what can we do? That is the injectable risperidone we can give. This is the long acting risperidone. So this is 2 month one injection or 1 month one injection they are giving. Okay. So injectable risperidone is the right answer. Okay, this is very important question and very easy question. Okay, some people not understanding this word no complaints. What is no complaints? This is patient is not listening to us. That is a no complaints. Is not following. Okay, then the best method of fluid calculation for first 24 hours is always Parkland formula. Okay, whole output Parkland formula is the right answer. Then tropoblastic diseases, that is molar pregnancy, also known as hydatidity for mole. Okay, after DNC. So anyway, okay na, drainage and curettage will do. Okay na. So what is the follow up care? Next, dilatation and curettage. Then frequent monitoring, weekly HCG monitoring. So, in case of molar pregnancy or tropoblastic diseases, so always HCG level will be increased. Okay, na? So it should come normal. That's why we are doing weekly HCG test. Okay, now once it comes normal only, so patient can be patient will be normal. Okay, so this is very crucial time. Okay, so tropoblastic disease frequent HCG monitoring or weekly HCG monitoring is the right answer and identify the X-ray. So here also we can see this chest, this lungs are normal here. Okay, but here see the heart this much big. So right answer is cardiomegaly. Cardiomegaly is the right answer. Okay. The next question: lifeline of Egypt river is the Nile River. Nile River because this is the desert area. Okay, this Nile River has given everything to them for drinking water and for transportation, everything. Okay, na? So that's why it is called Nile is the lifeline of Egypt. Okay, then a patient scheduled for ECT, priority nursing action is NPO or give pre-medications or connect to ECG. So, priority nursing is very important. Priority nursing action is NPO, nil per oral. Okay, why? To prevent the aspiration. Prevent the aspiration. So NPO is the right answer. And then not included in rapid sequence of drug. So this is used for the intubation. Okay, intubation, sedation. So which drug is not included is the diazepam is the not included because this is the anticonvulsants. Okay, but succinylcholine, midazolam, propofol we are using for the intubation. Okay, so hope you understood. So diazepam is the right answer because not included. Okay, then next lumbar puncture is contraindicated. Very simple question. Okay, very simple question. They ask lumbar puncture is contraindicated in increased ICP. Okay, this is the uh, spinal cord. Okay, so in ICP means full pressure will be there. So if you puncture, so this flow, but CSF will flow very speed. Okay, it will drain very fastly. That's why whenever increased ICP, we should not do the LP. Okay, we should not do the LP. Then mu score is 7. What is the next nursing action? So you can take the screenshot of this. Okay, na? So 0 is okay, 1 is okay, yellow category it will come. Okay, then 2 is also 48 hours patient to arrange category. Then red is 3 to 4. 3 to 4 is at least 1 to 4 hours up to we can wait. Okay, na? But more than 4 is always very dangerous. We have to inform the physician, contact physician, and immediate treatment. Okay, so mu score is 7 is urgent. Okay, so hope everyone done the good. And iron and folic acid dosage as per the anemia mukt bharat. So we have many confusions here. Anemia mukt bharat, the right dosage is 60 mg of elemental iron. iron, and 500 mg of folic acid is comes under the anemia mukt bar. Okay. And next, penicillin is invented by, this is also LKG UKG question, that is Alexander Fleming. Okay, so hope this session was very helpful to you. Okay, and another 50 questions will come soon. Okay, so if you have any doubts, you can comment in the comment section. Thank you. Okay.